We have completed a general abdominal scan. We studied transducer movements to find organs, evaluation of organs, landmarks, artifacts, and measurements. Now let's do a visual review of the pattern of the general abdominal scan to help you develop visual skills. Observe the change in appearance of each organ as we scan. Imagine the transducer position and movement needed to achieve the image you are seeing on the ultrasound screen. The transducer is angled cranially in a sagittal position at the patient's right side of the xiphoid. Increase depth and fan the transducer to the patient's right to find the gallbladder. Decrease depth to magnify the gallbladder. Decrease gain to reduce artifact. Press freeze and save a labeled image of the gallbladder. If you did not move the transducer hand, you will still have the gallbladder when you unfreeze the image. Fan to the patient's right and then to the left to view the gallbladder. Adjust depth as needed. Rotate the transducer to transverse and fan cranially, then caudally. Rotate the transducer back to a sagittal position. The transducer is angled cranially at the patient's right side of the xiphoid. Increase depth and fan or slide the transducer to the patient's right side till the liver disappears. Note that stomach is also on the ultrasound screen. Reverse directions and slide or fan the transducer to the patient's left side till the liver disappears. Return the transducer to the patient's left side of the xiphoid and rotate to transverse. Fan the transducer cranially and then caudally. Return to a sagittal position and save a labeled image of the liver. From the liver, angle the transducer caudally to center the stomach on the ultrasound screen. Decrease depth to magnify the stomach wall. Press the freeze button and use Cinematic Loop to select the best image. Press Caliper or Measure. Place one caliper at the interface of the hyperechoic lumen of the stomach and the hypoechoic mucous membrane wall layer. Place the other caliper on the outside of the serosal surface. Save the image to the patient record or archives. Unfreeze the image. Increase depth. Slide the transducer to the caudal wall of the stomach. Slide the transducer to the patient's right side in a sagittal position till the stomach disappears. Normal pancreas is caudal to the stomach and usually looks like fat, omentum, or mesentery. In many patients, you will not recognize pancreas unless there is a lesion. When stomach disappears, reverse directions and slide the transducer to the patient's left side till the stomach disappears. Place the transducer in an off-sagittal position on the left lateral abdomen cranial to the last rib. You should see rib shadows, the lateral stomach wall, and a short axis view of the head of the spleen. Slide the transducer caudally off the ribs, keeping the leading edge of the spleen to the left side of the ultrasound screen. Follow the spleen wherever it goes in the abdomen. Notice the splenic veins crossing the splenic capsule. Notice the intestines dorsal to the spleen. Now is an opportunity to get an image of the spleen and an intestinal measurement. Press the freeze button and use Cinematic Loop to select the best image. Label the image spleen and intestine. Press caliper or measure. Place one caliper at the interface between the hyperechoic lumen of the intestine and the hypoechoic mucous membrane layer. Place the other caliper at the outer surface of the serosal layer. Save this image to the patient record or archives. Unfreeze the image and continue to follow the spleen. See how the tail of the spleen tapers down in size. When the spleen is gone, slide the transducer away from the transducer index. Then follow the short axis, spleen, from the tail back to the head of the spleen. This time we keep the trailing edge of the spleen to the right side of the ultrasound screen. Place the transducer in a left lateral sagittal position caudal to the last rib. Fan and rotate the transducer slightly till you have a good image of a bisected kidney. A bisected kidney shows medulla at the cranial pole, medulla at the center, and medulla at the caudal pole. Press the freeze button and use Cinematic Loop to select the best image. Press caliper or measure and measure the kidney from the cranial pole to the caudal pole. Save a labeled and measured image to the patient record or archives. Unfreeze and fan ventrally and dorsally through the kidney. From a lateral sagittal position over the left kidney, slide the transducer to the cranial pole of the kidney to reduce edge shadowing. Increase depth to see structures medial to the kidney. Fan the transducer very slowly ventrally or dorsally to find the aorta and left adrenal gland. Color flow Doppler helps differentiate between blood vessels and the adrenal gland. The adrenal gland will not show color. Decrease depth to magnify the adrenal. Press the freeze button and use Cinematic Loop to select the best image. Measure the width of one pole of the adrenal gland and save a labeled and measured image to the patient record or archive. After zigzagging from the left adrenal, find the long axis view of the bladder. Decrease gain to reduce artifact. Fan the transducer to the patient's right side. Then reverse directions and fan to the patient's left. Return to a long axis view and rotate the transducer to a transverse position. Slide the transducer rapidly cranially and then slowly caudally. Rotate the transducer back to a long axis view of the bladder. Press freeze, use Cinematic Loop, and save a labeled image. From a ventral sagittal position over the urinary bladder, Slide the transducer caudally to find and follow the urethra into the prostate. Fan the transducer slightly right and left to find the widest point of the prostate. If you reduce gain to view the bladder, return gain settings to normal. Note the fat ventral to the prostate in this animal. Fat has a similar texture and can be confusing. Press freeze. Press caliper or measure. Place the caliper on the ventral and dorsal hyperechoic capsule of the prostate for a width measurement. Save the image to the patient record or archives. After zigzagging from the urinary bladder, the transducer is in a right lateral sagittal position over the right kidney. Adjust depth to magnify the kidney. Fan slightly ventrally or dorsally for the best image, and press the freeze button. If needed, use cinematic loop to select the best image. Press caliper or measure. Place the caliper at each pole of the kidney. Save a labeled and measured image to the patient record or archives. From a right lateral sagittal position over the right kidney, slide the transducer to the cranial pole of the kidney. Increase depth to see structures medial to the kidney. Fan the transducer very slowly, ventrally or dorsally, to find the right adrenal and caudal vena cava. Press freeze and use cinematic loop to select the best image. Press caliper or measure. Place one caliper on each side of the widest part of the adrenal. Save a labeled and measured image to the patient record or archives. We can use cinematic loop to scroll backwards to get a better image of the caudal vena cava. The right adrenal is usually between the cranial pole of the right kidney and the caudal vena cava. You have just seen a visual review of a general abdominal scan to help refine your visual skills. Each organ was taken from different animals in actual case studies. The images were presented in real time and in the order I prefer to follow for a general abdominal scan.